pleased to be here in this community that has come together to create a place of healing for those that have mental health and substance abuse issues. It's a model that we hope will be duplicated across the state. True partnership of folks in 9 counties to make this happen. As I said today, this used to be a prison, now it's going to be a place where people are set free, and that is a redemptive, hopeful story for Upper East Tennessee to solve a really serious challenge. I'm really happy to be here today, so I'm happy to take your questions. So all of the regional counties have put funding into this. We have made an arrangement with the community to lease this property at $1 a year. So we are, in effect, doing a long-term, relatively no-cost lease. And then the Department of Mental Health and Substance Abuse Services had put funding in as well, about $2 million worth of funding for the operations of the center. So it is truly a partnership between nonprofit, private sector, local communities, and the state, and really exciting about the prospects. What we have seen as we've understood the drug pandemic, the crisis, the mental health crisis that resulted from the pandemic, we have seen what addiction looks like, the changing face of addiction. And what's happening here is an attempt to solve a problem that has yet been able to be solved. So those who don't respond to traditional incarceration or traditional strategies, this is a next level. And what this means is that people that have heretofore weighed heavily on the community, been a part of the children's services and foster care and a pull and a drag on society, what will happen here is that they will become productive citizens and take the burden off of the communities and the taxpayers. That's what we're hoping for here. It's also important to remember that rural communities have been a focus of the Lee administration since the day we got in here. First executive order required every Department of State to provide a strategic plan to the governor's office for how they were going to positively impact rural communities. When I came into office, we had 15 what they call distressed counties. Today we have 8. Rural Tennessee matters, and we focused on it. We want to continue to focus on the economic improvement that happens in rural communities, like is happening in this county, and we'll keep at it.
If I could ask you about some side things.
Yep.
There was a report recently from TASSER about passenger rail.
Yep.
Is that something you would get behind, bringing that into the state?
I think our state has been heavily focused on transportation and infrastructure, as it should be. We're one of the fastest growing states in America. People are coming here, companies are coming here. We should and must and are investing in transportation and infrastructure. Nothing is off the table. Everything should be explored. We have, in fact, cooperated with and communicated with adjacent states. I've spoken with governors about the ability for us to coordinate together. So, yes, we should look at it. We should consider it. We should look at any ways that we can improve and strengthen transportation in our state.
Where does this recovery center rank on your list of achievements since you've been in office?
Well, this is not my achievement. This is an achievement of this community. It certainly ranks high in the things that I am grateful to be a part of. This is life-changing work. This is what communities should partner together with the government to solve the greatest challenges that negatively affect the most people. And families, individuals, entire communities have been ravaged in part by the drug epidemic that we have and the crisis associated with it in connection with mental health. When we address that, when the government comes alongside the people and the community, to support the work that they're doing, then good things happen. So I'm really grateful and excited about what's happening here.